Hi everyone, this is Dr. Malley from Onyx Dental. Today I was going to take a chance to discuss implants in a narrow ridge. If you're an implant dentist, you've come across this before. A ridge that's a really knife edge and less than 5 millimeters in width that you want to place a dental implant in. In those situations, this kit here, the OneMS kit by Hiossen, is the ideal situation. Gives you a chance to place 3 different types of narrow taper implants. The 3 types of implants that we can place is the narrow ridge MS implant, the MS denture, and the TS 3.0. So let's take a look at the kit. And neat little kit by Hiossen, and we will look at this part. Often when you're dealing with the OneMS kit, you are using a one guide fabricated by Hiossen Labs. Usually we can start with something like this, the tissue punch, often if we are not raising a flap for the surgery itself. When we're dealing with narrow ridges particularly, this key component right here, very useful, flattening drill, in order to get a nice flat occlusal table for the bone volume that we're working with. Going forward, if we are moving into something like an extremely narrow ridge, we're replacing something like a 2.5 millimeter implant, often we'll start with the 1.5 by 8.5. So for example, if we're placing a 2.5 by 11.5, often we'll still start with the 1.5 or 1.8, whatever your preference is to start with the implant system. You'll get some guidance from the One Guide team. Next, when we are placing an implant of that depth, we will stay within the narrow ridge around 1.5, however we'll expand to the 11.5 depth. Once we are hitting the critical depth on that implant, then we will expand the width of that. So for this example, we'll probably expand to the 1.8 or a maximum of 2.3 if it's hard bone. When considering placing the implants for the 2.5 diameter, often we'll be using a no-mount system. You'll see this driver here, particularly on the right-hand side of this implant system. It's distinguished as it has a window that allows proper alignment for the driver. Again, when you're looking at the driving of this, you can get engagement, which is very useful to use the separator tool. You'll see it fits perfectly into the window to disengage the implant itself. If we're placing something like a 3.0 by 10, again the TS 3.0 implant, around this space we would be starting around the similar width, whether that's 1.5 or a 1.8 diameter, going to a length of about 8.5 and leading to the same result. What we're looking for is a double point contact for this to get the best result from the One Guide particularly. And on the same token, once we're expanding in terms of the length that we're looking for, then we would expand upon the diameter. The difference between the 2.5 and the 3.0 implants is at the top right hand side of this implant driver kit. You'll see this one, which has the ratchet driver that will attach to the handpiece, the contra angle. Once you have the yellow markings lined up appropriately, you'll be facing at least one of the yellow marking towards the key cutout in the guide system itself. Once you're happy with that, you'll use the ratchet driver, separate from the handpiece driver, that will get you to the final position to get the final yellow timing correct. Again, you'll be using the upper right hand side. You have a ratchet driver, part of every Hiossen surgical kit, and again you can double check your torque settings. Beyond that, once you're finalized and happy with the position and torque, that you can either place a healing screw or abutment.